Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Bromium. This is part 2, general overview in a classical format, and the text is taken up from Allen's keynote. And this is a good revision for BHMS students and interns. So let us see first general information which is not available in Allen's. Remedy profile is a deep acting, long acting, but rarely used remedy. It is important in laryngeal affections and respiratory disorders. Kingdom, it belongs to mineral kingdom, and the formula is Br. Source: Bromium is a chemical element with symbol Br and atomic number 35. Preparation: it is prepared with distilled water up to the second potency, and then higher potencies are prepared with alcohol. Remedy was proved by Dr. Herring in 1838. Organ tissue affinity: it acts on respiratory system, heart and circulation, glands. The Allen's, we start with Allen's with some of the information is added which is deficient over there. So the constitution, the somatic aspect, it acts best but not exclusively on persons with light blue eyes, flaxen hair, light eyebrows, fair delicate skin, blonde, red-cheeked, scrofulous girls. Please note the chief distinction between bryonia, bromium and iodide is the former cures the blue-eyed and later the black-eyed patients according to Hearing. Thermal affinity, it is hot. Side affinity, left lateral. The psychic component, temperament part, the patient is quarrelsome. Mentally, delusions that strange persons are looking over patient's shoulder. Dreams of death, dying, fighting and funeral. Desires, sours and acids. Aversion to tobacco smoking. Causation we find in diathesis, scrofulous tubercular diathesis, and ailments from sailors suffer with asthma on shore. The characteristic generals include stony hard scrofulous or tubercular swelling of glands, especially lower jaw and throat. The characteristic particulars include face, sensation of cobweb on the face, nose, fan-like motion of Elanasi, throat, diphtheria, where the membrane forms in pharynx, beginning in bronchi, trachea or larynx, and extends upwards, chest pain running upwards. Membranous and diphtheric croup, much rattling of mucus during cough, but no choking, sounds loose, but no expectoration. Under respiratory, we also find croupy symptoms with hoarseness during whooping cough and grasping for breath. Dyspnea cannot inspire deep enough, as if breathing through a sponge or the air passages were full of smoke or vapor of sulfur. Rattling, sawing, voice inaudible, danger of suffocation from mucus in larynx, cold sensation in larynx on inspiration, better after shaving. Heart, hypertrophy of heart from gymnastics in young boys and for calisthenics in young girls is causticum. Females, physometra, loud emission of letters from vagina and membranous dysmenorrhea. Relationship, let us see, compare. In croup and croupy affections, we have chloral, hypersulf, iodium and spongia. Heart goiter, we have iodide has cured after heart goiter is cured after iodide has failed. Bromium has cured the croup after failure of iodide. Phosphorus, hypersulf, spongia, especially in relapse after iodium. Remedies that precede well are iodium, phosphorus, and spongia. Remedies that follow well are argentum nitricum and kali carb. Antidotal is ammonium carb, camphor, magnesia carb, and opium. The general modalities aggravation is from evening until morning, until midnight, and when sitting in warm room, warm damp weather, when at rest and lying on left side. Amelioration, any motion, exercise and at sea. Miasmatic orientation, we have miasmatic marker. Tubercular diathesis points to sorosyphilitic trait. An impression is bromium is a mixed miasmatic sorosyphilitic remedy. The posology doses from lowest to highest potencies are given. Repetition, it bears the repetition well. Duration of action is about 20 to 30 days, and applied or clinical aspect is it is good in asthma, diphtheria, croup, athletes, cardiac hypertrophy, physometra, goiter. So friends, thank you. Thank you very much for patient listening.